Hi, my name is Donnie. I'm a ICU nurse at Gateway Regional Medical Center. The purpose of my presentation was to educate patients and individuals within the community on cardiac health and resources available to them. My practicum site was with St. Louis Heart and Vascular. I followed a cardiac nurse practitioner. Her name was Sherry Tendell. She was great. Um, Very informative, very willing to teach, very willing to answer any questions I had, show me anything that I needed to see or wanted to see. Um, my topic was on cardiac disease. I did my presentation in the nurse practitioner's office at St. Louis Heart and Vascular. Their office is located at Gateway Regional Medical Center. I used the PowerPoint and posters and taught individuals how to take their blood pressure. But I didn't just teach them how to take their blood pressure, I taught them what it means. Once they get those numbers, I showed them a tool online how to take that blood pressure that they got and use that to determine their cardiac age. And that way they have some use for that information and understood it a little bit better. Um, I started as a tele nurse, and I kept seeing the same people or the same social class of people continually being admitted, and a lot were not compliant, and a lot didn't understand or know about their cardiac disease. And I saw that for over 8 months, the same people over and over again, and I just kept asking myself, why are these people keep coming in? Why aren't they doing more? Why aren't they participating in their own health? Um, the population that I chose was Granite City. I found through my research that the average annual income in the state of Illinois was 56,000, but in Granite City it was only 43,000 a year. Um, that the percentage of people who had higher than a high school degree was only 20%, and through the research I also found that there was a direct correlation between poor cardiac health and a lower socioeconomic class. There was also a very big correlation between people who smoked and come from a low socioeconomic class. So I thought it was a pretty good starting point. I mean, you drive around Granite City and you can see parts where they are trying to rebuild the community, but there are definitely parts that are older and more run down. A lot of the glitz and glamour of the city or the higher socioeconomic class of people started to move out or just didn't really do much to improve their life after the steel mills started kind of going downhill in the early 90s. Um, One of the objectives in Healthy People 2020 was teaching people how to take their blood pressure and then understanding what that blood pressure was. And I was really amazed by the number of people who didn't even know how to take their blood pressure or even know what the numbers meant if they could take their blood pressure. Um, the content of my presentation was a PowerPoint explaining the better choices that they could make and the impact of being proactive in their own health care. I had handouts about questions that could be asked at their doctor's office, and I stressed to them, hey, formulate a plan when you go to your doctor's office. Have questions prepared. Try to understand what's going on with your own health. Um, I also had handouts about medication compliance, and I also stressed to them if they're having problems affording the medications that they were currently taking, to talk to their doctor about it. There's generics that might be better covered under their insurance. If they were having side effects with some of the medications that they were on, they needed to talk to the doctors about possibly trying something else with maybe less side effects that might be more beneficial to them. I also talked to them about smoking cessation. Smoking's huge with cardiac disease. It's a direct link to poor cardiovascular health. I showed them links to online tools through Million Hearts, and I also showed them other links through smokefree.gov. My objectives were to try and get at least 75% of the participants to be able to take and measure and understand their own blood pressure. I also wanted them to be able to identify 2 resources available to them from what I presented. I showed them the links and everything that I mentioned earlier, but I also told them about clinics that the nurse practitioners hold with St. Louis Heart and Vascular once a month, and that they are at different sites, and they can get information about those clinics by calling the St. Louis Heart and Vascular offices. Um, I also, hopefully through education, wanted to reduce the number of smokers by 10% amongst hospital admissions by the year 2017. Maybe it's a little stretch, but maybe with some education and some resources that were presented to them, they can pass that on through word of mouth. My main points were simple. I wanted to provide information to empower individuals to make healthier choices and to participate in their own health. Change the culture a little bit. My experience at the my practicum site was great. It was really nice to see interactions with patients outside of a hospital setting. It was great to see how the nurse practitioners educated and worked with patients on the clinical side of things. And I got to sit in many clinical appointments and listen to the nurse practitioners talking about weight and diets, things that they can do to possibly help the patients. If there was medications that they couldn't afford, there was methods that they had to either get them that medication, or they even had samples that they would give patients. So it was very encouraging to see the patients being followed up after they left the hospital. So they were getting education and they were being shown the resources. I mean, there was a lot of times some of these patients that we were seeing at the clinical, I've had them as patients before. They keep coming back into the hospital. But, I mean, and education is constantly reinforced with these patients. During my presentation, it was very good to have hands-on teaching with the patients. It definitely got the most participation. There was only one person who really didn't participate very much. I think she was just trying to kill time. But the rest of the patients, the rest of the participants were more than willing to try to take their blood pressure. One lady even let us use her blood pressure measurements on the online tool to calculate her cardiac health, and she was kind of surprised. She was a 40-year-old woman, and after we did the calculator, it showed her heart age at 56. She was a smoker, she had hypertension, and she never got treatment for it. So maybe that's eye-opening. In my opinion, sometimes people need to see things and not just hear things over and over again. And maybe that visual aid will help her, further her own involvement in her cardiac health. I'm hoping that it gave her questions that she can go into her appointment and ask. The thing that I learned the most, my big aha moment, was realizing that there has to be a cultural change in order to make a difference. I mean, it was very nice to teach the small group. It was definitely a good experience, but teaching a smaller group isn't really going to change the culture. Hopefully through some word of mouth, more people can be touched, more people can be influenced, and more people can be empowered to make better choices. But it's definitely going to have to be a cultural change that probably starts at a lot younger age, that needs to be reinforced more frequently and more often in childhood. There definitely needs to be more upstream thinking of it, and not wait until there's already a problem and start educating a little bit more about how to prevent the problem from even happening. The one thing I would do different, it was difficult to get participants. I didn't have any males that wanted to actually participate in the presentation. It was only females. We were in a smaller nurse practitioner office, so there wasn't really a lot of room to do a presentation to a very large group. I guess I would probably advertise it a little bit more through the office, maybe set it up as kind of a clinic for people to go see, and I left information for the secretary at the offices to see if people want to go on there, but again, it was only a handful of people that actually participated. Getting that information out there just to get the resources out there is another problem that kind of has to be thought of, is people need to be taught what's out there for them, what resources can be available to them, but it's actually getting the resource of my presentation out to people that proved to be kind of difficult. That's something that definitely in the future I would probably expound on a little bit more, try to, I don't know, make sure that I had more people participating in some way or manner to get myself advertised a little bit better. Other than that, it wasn't too difficult once they were in there to teach them. They were very receptive, they were very polite. They didn't really talk very much, and most of them didn't have many questions afterwards. During the evaluation, that's when more questions came out. I guess in the future my evaluation would have questions on it to maybe elicit more questions from the patients themselves or the participants themselves. Through this experience, I take away a couple of different things. It's easy when you have a multitude of patients to kind of think of them as just a number. I have 6 patients, I got to get all of these tasks done, I have to get all of these things done. And it's hard to kind of be patient and ask more questions to kind of elicit more response about how these individuals approach their own healthcare. I guess I would try to ask more questions about, all right, so you're back again. What brought you back this time? Was the medications not working? Were you not able to get your medications? Were the resources that you were around, were they not helpful enough? Is there anything we can do to help you more? Is there questions that I can pose to the doctor for you? Maybe you need just someone to advocate a little bit for you. Maybe you're not understanding what's going on, and maybe if you talk to me, we can formulate something together, and I can pose it to the doctor in a way that would be beneficial to you. So in that regard, I think that's probably the best synopsis I can give as to what I would want to do or change in my practice, is just delve a little deeper into why people keep coming back. And throughout this whole experience, I find myself asking much questions. Even today, when I had a patient, he was in the hospital, been in the hospital a couple times, didn't understand why he kept going in the hospital, and hadn't really had much luck figuring out what was going wrong with him. So I remember just sitting down with him and just talking, and we asked about his diet, we asked about when these events started occurring. I didn't take more of a doctor's approach, I just took more of a nurse's approach, trying to help him formulate questions or help him maybe think of something that you haven't thought before. I ended up talking to him for about 20 minutes, which for all of us know that's a long time to spend on one patient in one patient's room to talk about their health. But after I talked to him for about 20 minutes, I went and talked to the doctor and said, hey, this is all the information that he gave me. These are the things that he was telling me. He keeps complaining about his neck and things. I think maybe a Doppler of his carotid or even an x-ray of his spinal column to see if he's got an hinge impingement or he's got orthostatic hypertension or something like that would be necessary. We ended up doing those things, and hopefully tomorrow he'll have some more results for when the next nurse comes in or the doctor comes in there. Maybe they can figure out what's wrong. So I guess the biggest takeaway that I had from this whole thing is don't just treat people as another number, another patient, another person that's in and out of the door. Treat them as an individual, and hopefully if that individual has a good experience and learns something, maybe they'll pass it along. Well, that's basically my presentation in a nutshell. Basically my experience in a nutshell. It was, like I said, Sherry was fantastic with any questions. She was very flexible with the hours in which I can get to the clinical. Very informative, a great resource. I would highly recommend her to anyone who wanted to see her. All right. Thank you.